Assalamu alaikum, the communication day. First scenario, the task. You are the doctor in the ward. Your patient is Mr. James, 63 years old man, relative, Mr. David, son of Mr. James. The scenario, Mr. James was admitted to the ward with pneumonia 2 days back and appeared stable. Last night, he had collapsed, and despite attempts of resuscitation, the team was unable to revive him and he was declared dead. The cause of his death remains uncertain. His son, Mr. David, couldn't be contacted during the night and he's not aware about his father's death. He has arrived today to discuss about his dad's health condition. The task is to break bad news about Mr. James' death to Mr. David and discuss further plan of management. Are you ready, Dr. Mayada?
Yeah. Yeah, we're gonna start.
Okay, here you go.
Hello.
Hello.
My name is Dr. Maidon of the Medical Doctors. Just I want to confirm that you are Mr. David, son of Mr. James.
Yes, I am.
Yeah. Hi, Mr. David. I am here to discuss with you, about your father condition. Is that okay?
Okay.
Okay. Do you want anyone to join us while we have this discussion?
No, doctor, you can proceed.
Okay, Mr. David. I'm sorry to have some bad news for you.
What bad news, doctor?
I think we are losing Mr. James.
Mhm. How come, doctor, you are telling me like this? How come? Just he was okay just 2 days back. How this occurred?
Yeah. It's hard to understand and hard to absorb all this information. But just let me to tell you what's happened. Is that okay?
Tell me, doctor, what happened?
When Mr. James arrived to the hospital, we found that we are treating him for pneumonia. Firstly, he was responding well to the treatment, and all of a sudden, yesterday, for unknown reason, we found him collapsed on the ward.
Doctor, you are sure of this is my father? Because he was okay. You are sure? This is Mr. David is the one died? No other one?
I'm afraid, yeah, I'm sure.
How, doctor? I supposed to take him today to home. He was okay. They told me he's improving. Why this occurred?
Yeah, I know it's hard to absorb all the things. This is exactly what's happened. He's collapsed overnight. We, as a team, we ran over him and we tried to resuscitate him. And despite all our effort to get him back, but unfortunate, he gone over and he died.
Doctor, I'm not believing you. You are hiding something. You are hiding something. I am not believing you. I wanted to know what is the name of the doctor treating my father.
I know this is hard to absorb, and I understand that you are frustrating and you are not happy about this news, and we are really sorry about it. The only thing that this is all that happened overnight, and we are treating him as a team. No specific person responsible about your father. All as a team, we are treating him. And we are sure that we give him the full treatment we can give in his case, and the real cause of death we are not really sure about at the moment, I'm afraid.
How you are not sure of the cause of death and you are the one treating him?
Mm-hmm. As you said, he was responding well to the treatment first for the antibiotic and the treatment for pneumonia, and we are happy about that. But all of a sudden, he collapsed, and the exact cause at the moment is not clear for us, and that's why we need to go further to find out what causing his death. This is the next step.
Doctor, this cause of death of my father is not clear for you. I
Mhm.
wanted to be clear for me. I am his son. How this
Yeah,
can be clear for me? I wanted to know the cause of death of my father.
yeah. So this is what I want to discuss with you now. In order to find out what causing the death, this type of death is need to go to the court, and
What is his score, the doctor? You mean coroner?
yeah.
Okay. What is this
Uh,
coroner will do with my father?
so they will investigate the cause of death, and he may need to have postpartum postpartum investigation. That means we cannot having the death certificate unless he have the postpartum examination to find
What you
out.
mean by postmortem examination of my father? You will make disfigurement for his body and he died already? What do you mean by this?
Okay. So, the role here in the hospital, as far as a doctor, we don't know what is the leading cause of his death. We need to find out, and this will be the only way to find out is by the postpartum examination. That means we need to open his body and find out. And this disfiguration you are worried about, normally it will be clean incisions, and it not cause disfiguration for his body for his funeral.
Doctor, before I am thinking regarding this, I wanted to meet the doctor responsible for the death of my father. I wanted to speak with him. What is his name?
Mhm. I understand that you are very frustrating, and as I said to you, we are working here as a team. No one responsible. The responsibility, in fact, it's all about us as a team working together, looking for your father. So there is no enumerated name to give you at the moment, I am afraid.
I wanted to raise a complaint. Whom I will raise a complaint against? I will raise a complaint against all of your team
Mm-hmm.
because you are
Mm-hmm.
the one responsible for this occurrence. How this negligence occur in the hospital? He's supposed to be discharged. He was improving. They told me only this chest infection and the bug and it will improve.
Mm-hmm. I know this is really hard to understand, and I can understand why you are in this anger. But as I said before, as we are not quite sure what's causing his death, we need to find out, and the only way to find out that by sending him for coroner and having this examination. And if there is any negligence from our side as doctors or as a medical team, at that time will be investigated and you'll have your rights. And if there is no obvious case, at that time you can have the death certificate and you can have your funerals. Is that sound okay with you?
Really, it is not sound good for me, really.
Mm-hmm.
I am not happy regarding what you are telling. And I
Mm-hmm.
wanted to raise a complaint. I wanted to
Yeah.
meet your consultant, your head of the department.
Mm-hmm.
Also, I wanted to raise a complaint. Where I can raise this complaint?
2 minutes left.
Okay, so the complaint can be raised on a patient advice office, and I can show you that. And regarding my consultant, also, I will give him a note that you want to discuss with him regarding this. Is that okay?
It's okay. But until you're doing your investigations, I am financially dependent on my father. What I will do for living.
Okay. For all this, I know that you are fenestrating at the moment, and we need to find out how to solve this. With the team, and I will send you for the team responsible about regarding the financial issues. I think this is we can discuss this further in another meeting to find out
What
how we
other
can
meeting,
help
doctor?
you.
I will make my own issues of buying my food. He's the one giving me money. I will solve this.
Okay, so the we can advise regarding the social team. They can advise you in how to resolve these things. Is that okay?
Okay, but still I wanted to know the name of this doctor. You cannot give me the name, and I will not
Uh,
tell anybody that you told me this name. Or where he's in your department, I think.
yeah, we are apart from this department, and as I said
So
to
you know
you,
his name. Who was present with my father at the time of this? He has not make his own great effort for saving his life.
in fact, he's not a one doctor. It is a team. This is a resuscitation team. When they found your father is died and he's collapsing at that time, so it was a resuscitation team. So it's a big team of doctors and nurses go together to in order to save your father life. But unfortunate, despite all their effort, this is not the case, and he was died.
Okay, time is up. 1 minute
Yes.
added already for further concerns. Perfect, Dr. Ahmed and Dr. Mayada. Really good conversation way. Let's have the comment from
Okay.
Dr. Ahmed, then I will comment.
Yes, excellent, doctor. Okay. You kept calm, and I am trying to make confrontation with you. Okay, the issue in this communication mainly is to be calm, and the son will be making you more angry. So you try to be calm. If you get angry, may you lose this station. I think what I heard before, because I discussed this case before. Okay, the first to make you should. I think you make the agenda. It is good, but I think because he doesn't know regarding the issue, you should endorse what you know about the health condition of your father, okay? And then you can tell him what is your expectation, what has occurred, or like that one. I think that should be told on the. So I will tell you told. I think pneumonia. I should tell bug infection of the chest, because maybe this is jargon he put in the scenario. Okay. Other, you can tell my condolences by me and all the medical team regarding the death of your father. It's okay. My condolences. Okay. So you are sad regarding the death of the father. Okay. Regarding the scenario, you are well, you are answering the concern. You have not told the name of the doctor, and you told that we are a team of work with each other. This is good also, because no one responsible. If you told the name of the doctor or one of our doctors in the department, or like that one is responsible, also I think you will lose this station. So better to tell all the team are responsible, no name. Okay. Other thing, what I raised also regarding the financially, because they, yeah, better to start to tell social support from the start, not to make another meeting. I think regarding this, because this issue, I think it is ready to be solved by them there. I think.
No, in fact, the we if there is any financial support, and these things will be for the patient, not for the family at all. So it's like the family. There is the hospital will not support the family, supporting the patient.
But there is
As
no
the patient died,
social offices for this, or
no,
or
no social
okay.
support for him. Actually, I
Okay.
just added it, but there is no social support for him.
Okay, but I think
Mm.
there is some department or something there to make support for the
Uh,
family, I think.
he can go to the community to someone else, but not the hospital.
Okay, okay.
It will be added,
Uh,
Dr. Ahmed, as any who's or who was living with your father by Dr. So
yes.
she will ask who was dependent or who's living with him, and who else dependent on him. If he asks for support,
Okay.
yes, you can offer support, whatever the kind of support, not only financial. So I will refer you to some to social services. They will help you. How? By what way? This is not our concept now. To refer him to
So
charity,
social
to
services is the one.
yeah, social
Yes.
only. It's not financial. Continue.
Okay, okay. Others good. The scenario was يعني you kept calm. This is the most important. The concern you answered. I think you have done it good. Excellent, doctor.
Yeah, thank you, Dr. Ahmed, for the scenario. And well done by Dr. Mayada, of course, as she kept calm till the end. The tone of Dr. Ahmed really, it's like professional actor. He was like irritating you by these questions. Who did this for my
I
father? He
tried
was,
to irritate her to make her angry, but she
yeah,
kept calm.
and
تعالى بص
Yes.
believe me,
ايه
in
ده
the
بص
sorry.
تعالى بص يا نونو اقفل الباب
Okay. By the way, in the exam, anyone will shout at you during the conversation, you'll be more stressed, like triple what you are facing now of stress. So better to be acting in this way. Be more angry, even shouts. It's okay. We are now accepting this behavior between us. But in the exam, believe me, it will be much difficult to tolerate the shouting of the patient, and you'll be more stressed. You forget most of the point if you are not calm and focusing. But we will go back for the introduction. I preferred if she asked about what happened to your father, what do you know about your father, as a background we used to do, supposed to ask, and to know what's his expectation, because I'm gonna break bad news about his death. So at least to know what is he expecting to take his father, and I will ask the expectation. If he expect to take his father, I will give him the warning shot and the golden silence. Then I will break the bad news. I think Dr. Mayada break bad news without these steps. And
Yeah, because I feel like
yeah,
I
go
give
ahead.
him hope. If always these scenarios, even in real life, I found it difficult. I think if I give the bad news, because now he's died already. But if I said what you expected, and I will give him false hope that I will give his father is already alive or something. But
Yeah,
if I shocked him and then
no, no.
start to
Let me tell
blame.
you the consequence. Whenever you ask him, do you want anyone to attend this meeting with us? Like you are preparing him for bad news. Believe me, this is a good thing you did. When you invite or you ask him, do you want anyone to attend? It means that you are going to break bad news. So you need some support, and I'm here to invite someone to sit with you to support you. This is the meaning of, do you want anyone to attend with you, or do you want to invite someone to attend this meeting with us? Means very bad news are coming. So whenever you are saying what's expectation, what do you know, it's okay. And the way of breaking bad news, believe me, they will give mark on this way in the communication skill. As we know, we have to start by the warning shot. I'm sorry, I'm not here, or I don't have good news for you today. Uh, I am not here to give you good news. Anywhere, try to prepare him with this warning shot and let him react with the golden silence. What happened, doctor? Tell me, is it something serious? Where is my father? How is he? Let him react whatever he wants to say. Then break bad news. I'm sorry, your father, or we lost your father, or your father is dead now. What? Are you joking with me like that? Or whatever he will react, also give him some time to react. Then continue your the explanation what happened. Actually, your father came and the blah blah, and he wasn't expected to have this death, and he was improving, but suddenly he had a collapse. We tried to do heart massage, or some doctors said this is jargon. So we tried to do some push to his heart to revive him. However, he didn't respond to this. Unfortunately, again, I'm so sorry to say he's dead now, and my condolences to you and to your family from all our team. He will react again, he will cry, he support him, offer something, tissue, water, then he will let him ask for the concerns. What happened, doctor? Exactly. Please explain to me how you expect that to happen. Whatever he will ask. And Dr. Ahmed already was already volunteered to tell you about the coroner. You told him about something else, but he said to you coroner. I think, yeah, you said the court. Uh,
Yes.
I think this is not the office for the
Yeah, I said
postpartum.
court. Yeah, you're right.
Coroner,
It
yeah,
is
coroner.
court. Yeah.
Yeah, the but he was kind one to tell you that. I think in the exam they will not do that. They will let you to continue with the court, no problem. What the relation between the court and this, they will not care. They will play with you the game till the end without except. But be ready to explain about corona in such scenario. Less than 48 hours or within 48 hours, death, unexpected death with healthy patient. He admitted with pneumonia, supposed to be improving. What happened exactly? Something different, something strange. We have to analyze and to investigate to know what's the bottom of this problem or this unexpected death. This is the main task of the scenario, the hidden agenda. Plus the breaking bad news, of course. You have to break bad news in the same way I told you. You are doing well, Dr. Mayada. Your way to talk, the accent, mashallah, it's perfect. You are calm. I need from you just to avoid some jargons. Apart from that, you are doing perfect. Uh, I think the jargons I mentioned already, the resuscitation and the what else? You mentioned some word else. Anyway, try to be in simple explaining about any medical term. Okay. Pneumonia, yes, pneumonia is one of the jargon. You can say pneumonia, which is bug in his lung or in his chest. We tried to manage this with antibiotics. Although he was improving, later on he was deteriorating, or it was improving, and suddenly, without any expectation, he had this death. The coroner, yes, the coroner role. You didn't explain. You said they will open his body. No, it's not a matter of open. It's just small cuts. You said incision also. This is a jargon. So you can say small cuts in his body or in his skin to pick up some snips from his organs and to know what exactly the cause of his death. This is the way how to explain the coroner and the cuts which they are doing without disfigurement. Be sure they will try their best to avoid the disfigurement. If he said, I am not agree for this, what you will do, Dr. Mayal?
This is not our decision.
Perfect. Yeah, so you know now. This is the difference between coroner and post-mortem examination as a medical researches or a medical purpose. They have to take consent in the medical examination post-mortem, but in coroner situation, it's not our decision. They have to do this, and we don't have any choice regarding this procedure. When I can take my father, I will try to talk with them to be as soon as possible, as fast as possible. However, again, this is their procedure. We are not sure when they will finish, because if you give him time or for example, if you say tomorrow, hopefully they will finish, you don't know. Sometimes they will keep the dead body for a long time, and the one who provide the death certificate are the coroners, not the doctors or not the medical the medical team. Okay. Clear now for this scenario? Any question, Dr. Mayada?
Yes, it's okay. Nice. Yeah.
Yeah. Again, the who's dependent, who's living, this is very important. Whenever you hear 2 minutes left, please try to address the support with family. Do you want someone to be attending now to explain about what we are talking about? Because he needs some support, either from family or from our bereavement team or spiritual team. He needs someone to sit with this patient and the family. They need some support, so don't leave it without support. Whenever 2 minutes left, tell him about the who's living, who will be attending next time to know about this declare, and if you need someone to attend to explain for him, he might say to you, "My mother is elderly one, and she will be shocked whenever she will hear this news." So support him in this way. We will arrange a meeting with your mother to hear to give her this news in pieces and in order to absorb her shock. Okay. Any question or any comment for this scenario? Dr. Mayada, you sent me the scenario, right? The
Yeah.
WhatsApp.
Yeah.
Okay. Any question from others before moving to where the scenario? This is Mr. Stephen, right? Okay. Mr. Stephen Hood, 72 years old man with background of colorectal cancer and history of stroke, is on long-term nasogastric feeding, nasogastric tube feeding. He is not a candidate for big tube placement. He was admitted to the hospital with aspiration pneumonia, his third such admission this year. Do not attempt CPR, resuscitation, or DNAR. Order has been in place since his previous admission 1 month ago. On admission, Mr. Hood required 100% oxygen to maintain an oxygen saturation of 93. End of life care discussion were held with his wife, who is his next of kin. She agreed to trial of active treatment with antibiotics for 24 hours. Anticipatory medications were initiated as per the palliative care team recommendation in case of clinical deterioration. Today, Mr. Hood has regained consciousness and his oxygen requirement has decreased significantly, now requiring only 1 liter per minute via nasal cannula. The focus now is to have a discussion with Mr. Hood about advanced care planning.
Okay. Can you share because it is
Yeah,
not
yeah,
shared?
I will share. Yeah, sure, sure.
Yeah.
Including his current understanding of his condition, his wishes moving forward, and to address any concern he may have. Good scenario. Actually, we didn't discuss such scenario before. Now I will read the comments just a minute, and I will share this scenario. I will make it in two parts because it's so long to be shared. This is the first part, and this is the second part. You can read it carefully, and we will start after 3 minutes. Okay, let's go to the comment. Postmortem examination, Dr. Sarah, perfect. Dr. Maha also postmortem, perfect. So now all of you, mashallah, get the hidden agenda of any scenario. Dr. Rashid, very expressive tone for empathy and sympathy. Mashallah, yes, I agree. Dr. Sarah, social services, yes, I agree. Yeah, this no comment, kind and angry surrogate raised all concern, and he raised the coroner by himself. Dr. Rashid Al-Baqa, Lillah, شد حيلك. Yes, it's really, it's yeah, in a funny way, but it's very important to provide condolences to the patient. Don't forget it, Dr. Miyada. It's a matter of support and also like yeah, it's something must to be done, right? You have to mention it.
Yeah.
Initially and at the end.
Mm.
Okay, so initially, after you deliver the news, so my condolences to you and your family. Then at the end, again, my condolences to you and your family.
Yeah.
Okay. Dr. Sarah, Dr. Rashid, even sometime they are just run some tests. We don't know what they are doing, so we will be just diplomatic. We don't know. They will do some tests and they might need some cuts. Yes.
Salam alaikum. You have to
Alaikum
explain
salam.
all options. Sometimes they just have a look, sometimes they just run some investigation, sometimes scanning, sometimes like that, and not necessary and to cut like that.
Yes, I agree. Even sometimes they can take organs. But if he asks more about the details, you will get the good or the full mark whenever you raise the issue of corona. This is your key to get full mark. The details, I think, just for complimentary, but
For
the most
Dr. Zero
important.
was fatal, I think, mistake when he said she will not concern about his only about the patient. This financial support, no, we have to be care about this. He was depending on his father, sir, and this is the right
Yes,
now to
yes.
support him and as much as you can,
Okay,
even
let's
by social
explain.
work.
Yeah, by social, but not financial. As Dr. Maeda said, they are not supporting the hospital itself, are not supporting the patient family. They will refer him.
She mean like this. أنا افتكرتها
Yeah,
إنه
no. She said
mm,
the hospital are not assigned to help family financially, and this is true. No hospital will say we will collect money for you because
no.
your father did, right? They will refer him to charity or some committees or whatever they are referring to them by social work, of course, not by
Yeah,
the.
this is right. It's
Yeah,
for six is right.
yeah, yes. Okay. The next comment, Dr. Sarah. Thank you, Dr. Rashid. Dr. Sarah must break the bad news very confidently without hesitancy. She said, I think we are losing. Yes, I agree. That's why I said you have to mention he's dead, not losing. Or we lost him, already lost, and he's dead in the same sentence. Losing Mr. David, that means he is dying, not already dead. Died. Yes, I agree. Some same opinion, Dr. Hatem. Thank you. Okay, this is the new scenario. Any question, comment, please add it. Feel free to add any missed point. So support is crucially important in such scenario. Support the family, support the dependents on the person who did, support the person who's talking with you now. Bereavement team also one of the teams who can support him emotionally. Please feel free to add a comment. Or if Dr. Ahmed ready, we can start.
Okay, just have a minute. Okay.
I will ask someone by name to comment.
Okay. A very long scenario, really.
Take your time. I will ask someone to comment by making draw. Dr. Maha. Any comment, Dr. Maha? What's your opinion about this scenario? We
السلام
used to
عليكم
hear your
ورحمة الله.
voice. Walaikum assalam wa rahmatullahi wa
Thank you
barakatuh.
so much. Dr. Basim, I'm really busy. That is why I'm just
No
listening.
problem. Okay, Dr. Salma.
Just excuse me, please.
No, it's okay. Dr. Salma, she's there? I don't think. No, she is here. But maybe busy. Dr. Sarah?
Yes,
Okay, we can start if okay, no problem.
yes, Dr.
Okay.
Basim.
Any comments, I mean, for the previous scenario? Any
Uh,
suggestion?
Okay, one comment.
Yeah.
Because she mentioned when he told her, I want to complain, she mentioned to him that I think I heard that she mentioned to him the investigation will be done, and if there is any neglect from our side, this will be investigated further. Did I hear well, Dr. Maida? Or
Yes, yes, because he's concerned that there is negligence. He asked specifically there is mistake happened from the hospital. So this is will be investigated by the coroner, and if they found anything, this is will be investigated further. Is if this happened in case. This is the reply
so,
for his question. If
so
this
I
happened,
believe from what I understand, and you, all the people here can correct me, and corona is to find the cause of death.
yeah,
Yeah,
the cause of death,
pathologically.
if it is the pathology, that's something can be treated, and this is happened. So the cause of death is caused by our negligence. It will be appear in the examination because
Yes,
Mm.
I
he
agree.
want to
I
have.
agree with this point. Yes.
Yeah, he want to know exactly. He think that we killed his father. So this
Yeah.
depends on the results of the investigation of the examination. If this happens.
Perfect. Yes.
Okay,
Let's.
let us keep it just simple. Okay, so if you sense that the patient is suspecting negligence, but he did not mention the word negligence, do not mention it
Yeah, yeah.
because it is sound very heavy on the ears. Okay, so just you can tell him that you have full. I'm sorry that the condition went to this point. You have full right to complain, and I will guide you to the patient advisory and liaison department. Regarding the importance of corona, it is going to be to investigate the exact cause of death, and then everything will be clear for you and for us. For us
Mm.
to
Learn
to
more.
improve our quality of the services that provided to our patients.
Mm.
Just
But why you want to add the quality by the coroner? The coroner, as Dr. Mayada said, we want to know
because
the
I
cause of
heard
the.
it because I heard it before with one mentor. He said that when the patient disagree and negotiate further with the candidate, he said to him, you can mention to him because he's suspecting. You know that he's suspecting, so you can tell him that the corona is very important to find out about the cause of death, and it is important to us also to find out about the cause of death and why this happened, and to improve our quality in the services that provided for the patient in the future by any means, without touching the negligence or anything else. Just
Yes, I agree for the point of negligence, not to be raised or
I
even
think a
questioned.
better answer for this, doctora, to say that it is independent authority and she will investigate this independently, and we all under the law. So we will give a clear result of this investigation, whether there is any problem happen or negligence. More than to say that we will correct, because if you said that, you are in doubt that you are making a mistake.
Exactly.
yeah,
I agree
exactly.
also for this point. So it's not for improving quality, because if you mention quality here, you mean it means or seems that or sound that there is some deficiency in your services.
But in general, يعني explain the job of the corona in general. Then the answer of the doctor is very يعني because he accused the doctor that you killed my father like that. So when you tell him the corona will approve if it is right or wrong, I think he will take deep breaths when he is hearing from the candidate like this.
Yeah, I don't disagree with her. I just didn't
Yes.
like the word negligence to be
Yeah.
raised by
So
her.
so yeah. So
هي
let's.
ده ردة فعل يعني من عشان
Mm,
Yeah.
اتهموه.
mm,
Yeah. So let's remove the negligence. Yes, really, it's a hard word here. So it's we are expecting him to be fine and improving. However, we are this office will be investigating to know what's exactly the cause of his death. That full stop. Okay, that's the end of the discussion for this point of the task of coroner. After that, let's see what he will say about his concerns. If he accused, as Dr. Rashid said, that time we will defend, but we'll not assume that there is something missing from our team. Okay? Maybe something else, maybe a natural cause of death. Okay? Thank you, Dr. Salma, for clarifying this point. Dr. Sarah wrote, that is right. Don't give him the impression of negative. Agree. Yes, all of us agree for that.
Otherwise, she did very good, mashallah, tabarakallah. As
Yes,
usual,
yes.
we enjoyed her language,
Yeah,
as usual.
perfect. Yes.
Yeah.
Thank you, Dr. Salma.
Her tone is very empathetic and sympathetic.
Exactly. Yes, she is. Thank you, Dr. Salma. Let's start. Dr. Ahmed, ready?
Yes.
Yes, here you go.
Okay. Hello.
Hello.
My name is Dr. Ahmed, one of the medical doctor here in the ward.
Hi.
Could I confirm that you are Mr. Stephen Hood, 72 years old?
Yeah.
Nice to meet you.
Nice to meet you, doctor.
Okay. Today we are going to discuss some health issues regarding your condition. Is that okay with you?
Yeah.
Okay. How much do you know regarding your condition?
Yeah, doctor, yesterday I was feeling like I will die, and this is good. Thanks God that I am here now and I feel more better than before. Yeah, I think I have this aspirate. As always, they said that I have this infection, but secondary to this tube I have for 1 year now.
Okay. So you have an idea regarding your condition of you have cancer and you were treated before?
Yeah, I know. All the doctors said that it's kind of not treated cancer, and that's why I have this tube.
Okay, thank you for sharing your information. Also, you have a history of clotting in your blood of some of the channels in the brain. You have an idea regarding this issue before also?
You mean my stroke?
Yes.
Yeah, I have this stroke. Yeah, this for and it's affect my swallowing as well, and that's why I need this tube for life. They said.
Yes, this tube is introduced via your nose, okay, to go to your food bag, okay?
Mm-hmm. Yeah.
Because, yes, because you were not candidate to make insertion of a tube directly to your stomach. That's what named the big tube. You have heard regarding this issue before.
Yeah, I think the nurse, the nutritional nurse, they have a long discussion this a while ago about this thing, and they put me on this tube, and they said that I may have this. I will aspirate, or that means the food can go to my lungs, and they told me, and this has happened over the past year. Maybe 3 times I've been admitted to the hospital. Last time I've been admitted to the hospital last month.
Okay. Okay. Regarding further in your management, what is your expectation?
I feel good. I feel good. I think I will go back home and enjoy my life with my family. I hope I will not come again.
Uh, I appreciate your feeling really, but we will decide by our multidisciplinary team regarding your further management. You have an idea why this?
What do you mean? I don't know.
Because regarding your condition, because your we discussed before with your wife the next of kin before regarding, because previously your oxygen in your blood was low, and we are giving oxygen now. You are improving more, but really because you know your condition. I'm sorry to tell regarding this.
What do you mean? I couldn't understand. I didn't get you.
Because you are you have cancer, okay, and your condition is advanced condition.
Mm-hmm.
So our multidisciplinary team decided that our treatment now will be for improving your symptoms. That one we are telling as a palliative treatment. You have an idea regarding this treatment?
No, I took this antibiotic and this fluid. I know they gave me through this thing, the cannula. Do you mean that?
Yes, I mean that we are giving treatment for improving your symptoms, decreasing your suffering, like giving, as you said, antibiotics if there is infection. If you have pain, you will give treatment to relieve your pain. Also, we can support you with nutrition for the feeding. Also, we can give fluids if you are not drinking well. So the treatment will be the palliative treatment care. Okay, I can also provide you with the brochures and papers regarding that one. So you can also buy next of kin. She can read for you if it is difficult for you to read. Is that okay with you?
Yeah. Okay. So
Okay.
when I can go home?
I appreciate your concern. However, you are improving, but you will be still admitted until we need more improvement. So because you are dependent now on taking oxygen at the hospital.
Mm-hmm.
It is going well that you are improving. However, now we will not discharge me after improvement. We'll have another meeting again with our consultant and we will decide regarding your condition further.
Mm-hmm. Okay.
Okay.
Yeah.
Okay. Regarding before, because it was discussed before in the previous admissions regarding if occurred like your heart stopped or your lung stopped of respiration, that there will not be interfered by the medical team. You still also decided that one, I think.
Yeah. They told me that there is no benefit from that.
Yeah.
Mm-hmm.
Yes. Yes. You have any concern?
Just the only thing that I need to know is you said that you will not discharge me from the hospital until I have my oxygen. The only thing I'm concerned, I've been coming to the hospital a lot of time. If there is any solution to that, if there is any definitive solution for that, to not have this aspiration again and have this infection.
I am sorry regarding your concern is valid. However, because this insertion of the tube direct to the stomach, it will be difficult for you, and you are not candidate for this.
2
So
minutes
this
left.
is the only way to receive your medications and also your food. And also this issue is already by your wife was raised, and we sit with her in a meeting regarding that one. And also regarding decision by our team regarding start of medications and antibiotics, as you know, regarding the bug infection that occurred because of this food that has been aspirated into your lung. And she agreed regarding the start of this anti-infective antibiotic agents. Is that okay with you?
Yeah, it's okay. Thank you. Thank you for her that she agreed for that. And I feel now I'm okay.
Okay. Regarding what you are doing for living your support, or you need any social support from us?
In fact, I'm not working for a long time, and I'm bedridden. I'm depends mainly on my wife on doing anything.
Okay.
She's my main
Okay.
carer.
Okay. We will also can support you by our social office if they can provide another support for you and your wife if they need services. But still, we have not yet decided regarding to be discharged at home. So you will be here until we make another meeting. Is that okay with you?
Okay, okay, doctor.
You have any concern? Other concern?
No, thank you.
Perfect, Dr. Ahmed. Really perfect. Well done. Time is up. Dr. Mayada, please, you can comment or you're busy.
Yeah.
Yeah.
There is a lot of things done well, but I think Dr. Ahmed, he is not discussed the task. The task is the advanced care planning. That means the EOL. So this patient he has the team discussed that he has recurrent. There is no definitive treatment for his condition. That means that this patient have this always he come to the hospital with the same things, that he have this aspiration pneumonia recurrent. So we need to discuss with him his vision about if this happen again, if he need to come to the hospital again, or we start the EOL. This is the advanced care planning. That's what they need to discuss in this scenario. Because the discussion is EOL with the wife, and we need to break this to the patient. I think this is all about the scenario.
This is what
Yeah.
I told him regarding this palliative treatment, the treatment of pain and
But
food giving,
you still
infection.
said to him that at the moment we are treating him actively with antibiotic and fluids and everything. But this is at the moment. But you didn't explore his idea about if this happen again,
Future, yes.
how you think to be treated, and you didn't explore if he's not able to have a decision to himself, if he can immunizate
Yes.
someone to take a decision in his behalf.
Yes, the attorney.
So
Yes.
it is advanced care planning. It is EOL
Yes.
scenario. I think it has
Dr.
not.
Maida,
Yeah.
Dr. Basim, if you allow me, I just want to ask Dr. Ahmed. Dr. Ahmed, what did you understand from the scenario?
Yes, the scenario regarding the expectation of the patient on the future,
Yes.
regarding what will be done in the future for him. He's still on his decision also that it is an end of life care. So no CPR will be done also. However, also regarding the admission in the hospital, again, if or he wants to die in peace, or what is, because he's advanced case.
طيب. What about the previous plan of management for him? Do not attempt CPR order
Yes.
has been in place since his previous admission 1 month ago. On admission, كده. So the end of life issues discussion were held with his wife, who is the next of kin of him. So the
Yes.
discussion about his future plan was discussed with his wife when he
Yes.
was unconscious.
Yes.
This is not valid now.
Okay, now, so I told him regarding, we have discussed before with your wife as a next of kin regarding your treatment. He told me this is okay. So I
But
understood
you don't
that he
know.
knows
You don't know
about.
what we discussed. You said for
Yes.
him that
Exactly. And
he
he's
have
yeah.
he agreed to have antibiotic for 24 hours and these things. And
Yeah.
now he's taking this medication, and he thinks that you are treating him actively. But
Yeah.
regarding that's the end of life care, that means we will stop the antibiotic, we'll stop these things if anything go in the other direction. So we can say that your condition is can be go in either direction. Do you ever think about if what we're gonna do? What is your wishes if
Yeah,
your
that is it.
condition
That's it.
deteriorated further?
Yeah.
Yes.
Do you ever
Yeah.
think about it?
You have to
Yes.
ask him,
Mm.
again from the start.
Yes,
Yani,
exactly.
what are your wishes? What do you think you want us to do when your condition deteriorate again? Ask him what he want to be done for him. Then
Yes.
if he said to you, I need to be saved, I need to be CPR done for me, explain to him that in his condition that will not benefit him, and that will worsen his condition more and might affect, like we are explaining the CPR, that it can broken ribs like this, I think like this. And then after that, you tell him that's why do not resuscitate will give you more like peace of mind and more painful event. Don't say this, of course. What do you think, Dr. Basim? We should negotiate with him to sign again the same plan, right?
Yeah,
Yes.
sorry,
Yes.
Dr.
Yeah.
Salma. The
Mhm,
DNCPR, this is already done previously and he knows about it and everything. The discussion now is about the end of life care. So the end of life care,
mhm,
that means if this patient, his condition now, he's still in the hospital and he's still,
mhm,
he may go back to the home and aspirate again because the condition, if he has NG for long time, for his feeding.
mhm,
And if he has aspirate again and condition
mhm,
deteriorate, if he need to come again to the hospital and treat it actively, or he can be end of life. That means
mhm.
he have anticipatory medication at home and treat it at home and die in peace at home if this is his decision.
Yes. Yes,
So
and you have
the main
to say
thing
it
is
in a
that
very sympathetic way. Yes.
yeah.
Yeah.
So we
Mm,
need to understand what he think about this and why he, if he's dying, why he want to die. Is he want to die in the hospital or he want to die in the at home? Or where
mm,
if he lost again, he has his next of kin, his wife yesterday, like we discussed with her the EOL thing. But if he again lost his conscious, he needs someone specifically to discuss his treatment with us. What
You mean advanced
Yes, advanced directive
fine,
and lasting more
directive?
recovery.
yeah,
Mm, mm,
yeah.
mm,
And if he has
mhm,
any wishes, he need any support at home when
mhm,
he approach his end of life, because this is patient
mhm.
anyway dying in this
Okay.
admission or in recent future, in the recent
Mhm.
future. I mean,
Yes.
I
Okay.
think we are just taking like a living will from him.
yeah,
Yes,
Yes.
you
yeah,
have to
that's
ask
Yes.
this. Yes.
Yes.
Update his wishes, update his plan of management in the future, updating, because the other one is not valid now, because it's taken from his wife
his
when he
wife.
was
Yeah,
unconscious. Now
Exactly.
Yes.
he's conscious and he should tell you that he agree for this or he has a different wishes, and then you should react accordingly to his wishes, but putting in your mind that that is end of life in any situation, because his situation is very poor. About the wasting the time, what do you think the solution? Because Dr. Ahmed, I saw you in another scenario also. You are repeating the condition of the patient which given to you in the scenario, and the patient already know about it. And this wasted, I counted for you this time, 2
Mm-hmm.
minutes and half. يعني تقريبا 2 minutes and half or more even,
Yeah,
asking
explaining
about the
his condition, which he
explaining
knows already. Yeah.
which he knows, and also he told you they have a long meeting with me explaining everything to me.
Yeah.
So what do you think is the solution in this case, Dr. Ahmed?
The
The
solution.
expectation. Yeah.
Mhm. How are you going to uh, improve this thing?
She mean
We will
that.
ask regarding his expectation and his living will, and the lasting power of attorney also.
No. She's asking
No.
particularly about the background. You ask about
The
background of the
background.
patient, and
Yeah.
I repeated it again after you heard from her. So
Yeah.
Yes,
she advised you not to repeat
yes.
Not
what
to
she.
repeat.
Yeah,
Not
that's
to repeat.
Thank you for sharing your information. I
Thank
can
you
like
for sharing this information. And
move forward to the task. Yes.
immediately,
Yeah.
immediately. Yeah, your condition, as you know, your condition is advanced. You have multiple admissions in the hospital with deterioration of your original condition.
No, the
Just
problem, Dr. Asalma, when I asked regarding how much do you know regarding your condition, Dr. Mayeda has not informed me regarding that I have colorectal cancer, I have a risk of stroke. So that one make me to repeat the information again.
mhm. Repeat it in
Okay.
one sentence,
Yes,
putting in your mind that
yes,
you have time. You
yes.
repeat it like, and do you know that you have a background of cancer? She said, yes, I know that, and blah blah. And then you told her, and do you know that you have a clot in your? And she said, yes, and blah, blah. No, in one sentence. As you know, your condition is advanced. You have a history of colon cancer, and you have multiple admissions due to this cancer in your management plan. Today, what happened? You concentrate in today. What is the problem today?
And
Jump.
if the condition
Yeah.
deteriorate, that EOL.
Yes.
This is the main task, that
Exactly.
the condition deteriorate, because he knows he lived with this cancer for years, and with the stroke
Yeah.
for years, and his NG, he said for you that he had this NG feeding for a year, so he knows about this condition during this year time. But the new thing that now he's reaching the end of life, and you want to
The end of
break
life.
this
Yeah.
for him and to
Yeah.
understand what, the things.
Yeah.
It's EOL scenario with the patient himself.
Mhm.
I
And
think EOL
yeah,
scenario is like a palliative care. يعني what I tell the palliative care, it is EOL
no,
also.
no,
It
no.
was
Palliative care is different than end of life because palliative care, the patient can live for years, but end of life, that means it is imminent. It is
perfect.
sooner,
Yes.
sooner. So the patient need to hear this word because they are familiar with this word, not like us here. So based on your history and your condition and multiple admissions and your suffering, the team has decided to put you in something called end of life care. Have you ever heard about it? Do you want me to explain more about it? Yes. What is this? And this is blah blah. You can mention this because based on your situation and multiple admissions and your suffering that you are suffering, we almost lose you the last time. You can just make it bigger for him that his condition is very advanced, and because your condition is very advanced and you are suffering so much, this is in your best interest. The team has decided to activate what we called end of life care. Do you want me to explain more like this?
Okay.
And then go on with your scenario and ask him after explaining the end of life care. Can you tell me what is your wishes now? What do you plan for your management? She mentioned to you that she want to go home. Clearly, I don't want multiple admissions. Is there any solution for me at home? Uh, I don't know. In this case, you can start asking like usual by why you want to go home. Because I want to be with my family. You said that these are my final days. I want to be with my family. Okay, that's a good thing. Yeah, you will benefit too much from being with your family, but we need the team to evaluate your condition and the housing condition to be if we can discharge you to your home. Evaluate your condition and your house condition and to see if we can discharge you. Like this.
Exactly. And by
Mm.
the way, the oxygen can be provided at home. It's not
Yes,
a matter of
yes.
oxygen.
Can,
If
yeah,
you want to
can
say a
be, yeah.
reason, yeah, so it will be something else, like receiving medication, antibiotics. Even the medication can be received at home. So it's not a problem to send him home. And in this case, I think, Dr. Mayada, we can activate the track discharge.
Yeah, this fast drug
Right.
trial discharge. Yeah.
That is
Yeah.
what I am writing now, Dr. Basim. I think we have to encourage the starting home.
Yes, I agree.
Yes.
So Dr. Ahmed misunderstood the case or the scenario like patient improved. So we can now talk about not end of life, we can talk about palliative care, which is not the case here. Actually, it will be clear in the task, Dr. Ahmed, that they write for you end of life care, although it was explained to the wife, which is the next of kin. But now we have the patient himself. I have to explain and to address this point to the patient himself. And I believe this scenario, you have to raise the wishes earlier, even before end of life care decision. So now we can see like you are improving after a trial of antibiotics. We have this been discussed with your wife, and we want to know from you what's your expectation and what's your wish regarding your treatment, because we are unable before, or we were unable before, to talk with you. That's why we discussed this issue with your wife. But now we have you, so we can talk with you directly to ask you what you prefer. If he raised the issue, or what you wish, not prefer, because prefer mean he can choose. No, what's your wishes? Do you have some wishes regarding your medical management? If he raised the issue of treating at home, so yes, it's the time to raise it and to say this is a decision by the team. It's called end of life. We can send you home, of course, if your condition is suitable to go home, and to assess you before discharge you, and we can activate what's called fast track discharge. Then explain the end of life care for him. So the aim of end of life care, we want to maintain your dignity and quality of remaining part of your life. Although it's not that much long, it might be shorter than expected. Be honest with him, break the bad news, as Dr. Salma said. You have to make it as breaking bad news. End of life. He everyone knows or can understand from the term
Yeah,
itself.
Dr. Basim, one word coming to my mind, طوعة الحياة. Some people before death, they have unexpected improvement for
Yes,
hours
yes,
and then they will die. So he
perfect.
was
Yeah.
just, yeah, اتخدع بس بالسيناريو that he is being okay, but he's not okay at all. This.
Yes, exactly. Yes, you're right. Some patients before they died, even in ICU, in our ICU, we noticed that they are improving from the circulatory support, even the conscious level. They regain conscious level for maybe couples of hours, even during the visiting time. They will notice, oh my God, she's better, she's improving, and unexpected at after visiting time, the patient crashed to the severe shock, even collapse, arrest, and did. Imagine this, صحوة الموت, as you said exactly. So yes, he's gonna die within days. We don't know, within hours, within weeks, but still he's terminal case, and we have to raise as a task end of life care. Regarding feeding option, I believe if he asks you to get a feeding through his mouth and he's unable to swallow, we can reassess that, just to give him some food which he prefer before he die. So we can say, not to say it's not fitting to do this or that. We can say, if you, we will assess you regarding this again, the swallowing, and if you are unable to do so, we can start it. This is what I heard also. They can give them what they want at the last days of their life. So
Even
just
if
to,
the patient is a smoker, Dr. Basim, he can continue smoking.
okay, so you want to provide, you want to
There is
offer him.
a debate about
No,
that.
no, no, no. I will not offer, but
Yeah,
I will
I
not
will not
stop him.
mention.
Yes.
I will not
yeah.
mention it. I will not ask
No,
Not,
no,
about
no.
smoking in this scenario. Yeah, but
No,
yeah,
I
not
will
to
not.
ask
I will
and
not
not
ask
to
the
stop.
patient about the smoking. Yes.
But if
I
he
will not.
asked you, doctor, do you think I can smoke? Yeah, you can do whatever you want, whatever you wish, and let him enjoy his last days. Yes, you're right.
Last days. Yes.
yes,
Exactly. Yes.
I agree.
Yes. Okay. Perfect.
الحركة دي احنا السودانيين بنقولها فجة الموت، يعني الأيام اللي بتكون
Yes.
patient
Exactly.
فيها
بس
كويس.
جبت
أيوه.
الكلمة في راسي ما لقيتها. فجة
Yes.
الموت، فجة الموت. فجة الموت. أيوة.
Yeah. In our language also صحوة الموت يعني the last consciousness of his life. So he will see the family say bye bye or goodbye, and after that, subhanallah, they die. But in general, Dr. Ahmed, I think this is the first or second communication. First communication. You are fluent. You are confident while addressing and answering the concerns. The introduction. So it's good to practice more and more and to pick up the task, even the hidden agenda. In this scenario, it was written clearly end of life care, but it was also twisted whenever you hear the patient improved. So let's talk about palliative, not the end of life. But to maintain the dignity, we want to be sure that he's dying in peaceful way with his family. Let him die at home as he wishes, or according or whatever what he wishes. You can ask him what's your wishes, or what's do you have any lasting power of attorney, or sorry, the question of do you nominate anyone to take decision on behalf of you, or do you have any written wishes at the court, or the usual word or the usual question, what's your wish or what's your living wish regarding your medical management. So he will share with you the management plan, and this is the aim, and this is his right. The right, as we know before, the ethics and legal issue. Legal issue, we know them. The ethical issue, the legal issue, we know them, which is sharing and addressing the management plan and deciding also for the management plan, which is called the Irish people who knows this one. Who knows the definition of this?
beneficence
No,
مش كده؟
no beneficence. Do good to the patient.
non-maleficent,
Non-maleficent, don't harm or don't
harm
harm
the
the patient.
patient.
Harm, yeah, don't harm the patient. No, they are four, right? This is
What is
the
the question?
ethical. Sorry.
What is the question? أنا ما فهمت السؤال.
أنا صحيح السؤال ما فهمته، خليه يقوله
autonomy
تاني.
What is the question?
The question.
autonomy.
Oh, yeah, this is the one. What is I'm talking about? What is the sharing management plan and deciding for the management plan with the patient? This is what we called.
autonomy.
أنت قصدك
Yes.
الissue ده يعني what is the issue here?
Yeah. This is the ethical issue. So autonomy, he will decide with you. He has the right to choose and to share and to decide at the end, right?
Yes.
The autonomy. So he will
Yeah,
decide.
that's
And
why,
if
Dr.
yeah,
Basim, that's why when I comment, I told you if the patient told you, I am okay now and I want to cancel the do not
yes,
resuscitate, what you are going to do. This is my comment. Not you are going to speak or to talk about the issue again. No, I told you if the patient, you will ask the patient politely, what is your wishes, what is your plan
yes,
on
yes,
future management. We agreed for this, right? For this question.
yeah.
So we explore the patient expectation about his management. What if the patient told you that I want to be treated, activate the treatment, I want the DNR to be cancelled? What's your reaction in this situation? Knowing that this
Perfect.
is end of life issue. That is why
Yeah,
I commented. But
perfect.
maybe the doctor who answered me, he didn't get my point. So
So you will
I
negotiate,
told,
you mean? We have to negotiate with the
yes,
patient.
I
Yes.
have to tell him that CPR is not beneficial in his condition,
Yeah. And this is a
and
medical decision.
this is a medical decision in his
And explain why,
yeah.
Dr. Salma. We have to explain why we
Because,
are
yeah, I
decided
told
for that.
previously also, based on your condition and your
Suffering,
suffering, your
admissions. Yeah.
multiple admissions.
Yeah.
We almost lose you last time. And fortunately, you are here with us. But see, we know that the medical team decided that the CBR will not benefit in your
Plus,
condition. And
plus,
yeah, and you will lose your dignity. It will harm you. You all the
exactly.
all
Exactly.
the side effects that can happen to him,
Perfect.
pain, fracture of ribs, everything you tell him, and then you tell him, do you agree with me? Like this.
Plus, even the outcome of this procedure, which
Mhm.
is a
Will
heart
not be
massage, yeah,
perfect,
will not give
perfect,
you
yes.
prolonged,
Will
or
not
which
give
will
you
not
for a
prolong
long
your
time.
life.
Your
And
life, yeah.
if happened, if prolonged, it will be with more suffer than you are in already.
Yeah.
So it's yeah, you will negotiate and explaining the harm and the benefit of not doing this. The benefit of not doing CPR to maintain your dignity and to let you die in peace. And the harm of the CPR is broken the bones, chest wall, and the tubes inside your mouth. Plus, no benefit. It will just extend your suffering you already had, or you already on. Okay. Thank you, Dr. Salma. Yes, it's really it's a good scenario. Thank you, Dr. Mayada, also for this scenario. I felt like nowadays the scenarios are not straightforward. If you notice, there is scenario in Abu Dhabi today about someone can remind me, and we can practice this scenario soon.
The near medical error. Near medical error.
No, no,
I
another
think no,
scenario.
no, no. The scenario of multiple pulmonary embolisms. Yeah, right.
Multi-pulmonary. No, the first scenario.
Postmortem. Postmortem. They find that the patient is having multiple pulmonary embolism. You mean
No,
that
no,
one?
no. No, no, there is another. Postmortem is known scenario, by the way. So you can
Mm-hmm.
talk about coroner and
It's new, like the patient had peripheral neuropathy and he denies that he treated. But the wife says that in the
Dr.
scenario that
Dr. Aisha, your sound is so far. Can you please closer to the mic?
She said to you, it is the wife raised the issue of that why the image there is an image should be done to
Yeah, yeah.
diagnose pulmonary embolism.
It was done in the
Why
best
the image
interest, but it didn't show because it wasn't for PE.
it didn't done.
It didn't
The
done.
Yes, yes. In this scenario in Abu Dhabi, they mentioned that the junior did ECG, CT scan, and diagnosed asbestos-related plaques and
Yeah, yeah, yeah.
stroke.
I
But
remember
This
now.
is old, I think, old
Yeah,
scenario
this
also.
is old scenario. Yes,
yeah,
yes. Known
yeah,
scenario. Again, it's not the cause of death because PE might happen at home even during this duration after
yes,
discharge. So it wasn't there, and it was treated, or he was treated in the best interest of his condition. So it wasn't there. Okay,
yes.
this
But
is
believe me, we practiced it before. But believe me,
yes.
some people told me that they dealt with it like medical error.
No, no,
Because
it's not medical error at all. If you do it in medical error, you will lose the case.
yeah, I told them it's not
Yeah.
medical error at all. Yeah.
Okay, the scenario I'm talking about, palliative treatment of pulmonary fibrosis patient started
Mhm.
on antibiotics after feeling better, but consultant decides for high inflammatory markers, low saturation. She doesn't like the consultant and keeps saying, "I am going to die." So he was for palliative pulmonary fibrosis on oxygen, but he's not responding. Despite of this, he's worsening, and now he's unsatisfied by the consultant. He want to change the consultant. This is what I understood. Anyway, it's his right to choose or to change the consultant. However, the management plan will not be changed. This is the way how to say to answer the or to address the concern. I want to change the consultant, or I need another consultant. So, yeah, it's the patient right to ask for another consultant or another opinion. However, the management plan will be maintained as same, and your condition sadly is not improving. And yes, if he ask, I'm going to die, doctor. Again, answer in honest way. I'm afraid to say, yeah, in your condition, this disease shortened the life, and since you are not responding to this medication, unfortunately, you might die according to the scenario within hours, within minutes, within days, whatever. But you should answer in clear way. Yes, if he asks you, I'm going to die. Yes, unfortunately, and sadly, I'm afraid to say, yeah, in your condition, this disease shorten the patient life. Although you are on oxygen, but still you are not responding to the oxygen. That's why your life now is threatened by this. This is what I guess also. I am not sure about the detailed scenario, but I think this is the way how to address. I think,
why he want to
yes,
change the consultant and what is
yeah,
the reason behind it? You want to
yeah. Some patient does, they are not satisfied by even the patient, the consultant, look, they are not preferring to be managed under this consultant. They want to change from this consultant to another.
no, I mean he
Also,
want to continue antifibrotic يعني ولا
they didn't mention wallahi in the scenario, but if this issue raised with you in any scenario, so it's a patient right. But tell him the change or the management plan will be maintained as same. No change of the management plan, because this is a medical guidelines, not the personal opinion. But
yes.
some people, they are looking for another opinion, so you can provide him, agreed for that. And this is, by the way, again, it's his right.
Yes.
Yes.
But I will
The
follow the
other,
task.
yes. Other
Uh-huh.
other strange scenarios that I am talking about,
Yes,
if
Dr. Aisha.
the patient diagnosed with have a peripheral neuropathy, and after investigation, they decide that it is alcohol, and the wife already said that he drinking a lot like that, and they write in the scenario you will smell the alcohol, although you are at 1 p.m. you will smell the alcohol smell from the patient. When you enter the station, he
He's denying.
denied
Yeah.
yes, at the end of the scenario he still deny that he drink, and he negotiate about what is the cause, and I'm sure that I am not drinking, and I drink like my friends, and I have no it's not the cause
Okay.
like that.
What do you think how to address this scenario, Dr. Aisha? What
I
you have
think
to raise? Yeah.
like the suicide, this suicide that he deny about suicide, like
No, no,
tablet.
I don't think. You know what you have to raise in this, in any alcohol
You should
scenario?
mention the complication of alcoholism
No,
and
no,
offer
before.
alcohol.
What you should raise in any
At
alcohol
first,
scenario?
you should raise the confidentiality, and this,
Yes,
and
of
will
course.
support you, and will be, yes, like
Okay,
suicide attempt, the same. I think it will be the same, because if he deny,
but
you should
what's
raise making some friendly with the patient, and or with the surrogate, yeah.
okay? What else you have to raise and to ask as a questionnaire?
The cage questionnaire should
Yeah,
mention here, but he
yes,
deny all.
no
As
problem. You
my
have to ask
friend
him.
tell me, he deny all things.
Okay, there is question related
But the
to.
point here, you will not tell him about the wife what tell, and you will not negotiate about he smell alcohol as they said in the scenario, and
Avoid
you will
confrontation.
negotiate.
Not
Yes,
not only confrontation, it's affecting welfare. Yes, it's like
yes. So
he's
you will
liar. Yeah.
remain also making around the situation, like
Yeah, they are playing with the scenario. As I said,
yes,
tricky scenario with twisted ideas. I believe any alcohol scenario, please put it in your mind. Any alcohol scenario or any alcoholic scenario with the hepatitis or cirrhosis, raise the issue of cage questionnaire. Do you feel guilty? Is this the first thing to do in the early morning, which is eye opening? So, cage, cut down. Do you have any idea, or do you prefer, or any wishes to cut down your alcohol drinking? All answers supposed to be, if he is alcoholic, yes. So he will be answering in yes in all questions. Let's repeat them. Cage, CAGE. Cut down. Do you think you want to cut down your alcohol drink? And the A, uh, about annoyed. Anyone or you feel annoyed with your drinking? And the G, do you feel guilty for your drinking? And the E, the last E, is eye opening. So is it the first thing to do early morning after you wake up? These are the questionnaire should be mentioned in any alcohol scenario, especially those patients who's negotiating with you. No, doctor, I am not. So ask him this question. If he mentioned 3 of them positive or yes, it seems he is alcoholic. Okay. And you can refer him to the alcohol services clinic. Dr. Mayada and Dr. Salma and others, any questions or comment regarding this scenario, the alcohol? Dr. Mayada, particularly because she's in UK. What do you think, Dr.
Alcohol
Mayada?
scenario.
Yeah.
I'm just. I was sorry. I was just searching. One day I
Yeah.
have. The palliative nurse. These nurses are very good in discussion in EOL things. I wrote. I just go with her and I wrote what she said to the patient. I will send this in the group, or I
Yeah,
can tell you
please.
how she's talking to the patient, so it can give idea how to negotiate these EOL things. Her approach, how she approached to the patient, and how she said to him things, so it can
Okay.
be helpful for
Perfect.
everyone.
Yeah, perfect. Okay, what about the alcohol negotiation? Did you hear the scenario?
Yeah, I think it's difficult scenario. At the end, we can't tell the patient that you are. We are not believing you, but still we are thinking about your symptoms is related to alcohol issue. It's
Yeah.
yeah, but it's difficult scenario because he's denial that he's not doing this,
Yes,
and
exactly.
at the same
Yes.
time we can't say that you are lying.
Exactly. Yes. If you do that, you will they will minus you in the welfare.
Yeah.
I
Again,
think we
again,
can said at the end we have like specialized team about your situation. They can sit with you and
Yeah, referral.
explore more with you and provide you with more information about your condition. So and decide with you the management plan and this. I think it is all, and maybe we will set also the alcohol abstinent clinic or alcohol station clinic or no, I don't know. Yeah,
Alcohol.
if you
I
Yeah.
prefer alcohol services only. I don't hear about alcohol cessation. Dr. Mayada, she can also say what she has in UK about alcohol services. What they are calling.
It's not sedation because if you
Yeah.
stop alcohol suddenly, he will have
Yeah.
alcohol withdrawal symptoms and everything. So it's just a minute.
advise like
Alcohol
that. Mm,
advisor, yeah,
mhm.
advisor and alcohol nurse. As you said, there is alcohol nurse. They will take care about this patient. There is community alcohol nurse and hospital alcohol nurse according to the patient. Where is he? So they will deal with him and they will decrease alcohol. They
Gradually.
have
Yeah.
And I
casual.
think also the sentence that we can also make him encourage him to speak that at some point we can the bad effect of alcohol can be reversed, but at some point we can't do anything with the damage. You are with me in this sentence or no?
Yes, yes, of course.
Mm.
Yes. Supposed to explain the harm of the alcohol over the whole body, not only the liver.
Also, we
The liver
can
is carrying.
like discover with him you have stresses, what do you do for living? You like we can open any questions he can said.
Generally, for alcohol
Yeah.
patients, I think safer to refer to alcohol nurse because this is normally what we'll do because it's a complex thing and it's not one day
Yeah,
scenario.
yeah. It's not
So
process for one day.
yeah,
It's
it needs
process of long
like
time. Months, yes.
lifelong. So I think even in the communication scenarios, if you said to him, I will refer to alcohol nurse, it will be safer and it will be in the correct side.
Mhm.
Perfect. Yes. Okay. Thank you,
Maybe
Dr. Mayada. Thank you, Dr. Aisha, for the sharing these points and comments. There is one more comment in the chat box. Dr. Hatem, any advice from where to read more about end of life, palliative, post-mortem, DNR, and so on? I think Arroch, right? Arroch,
Dr. Basil,
yes.
I sent in the group the NHS explanation
Okay,
for end of life. It's
perfect.
very good, very, very good,
Perfect. So it's
very
good.
good.
Okay.
Yeah.
And there is also a variety of scenarios in the Aruch book. All of them already explained, like end of life, palliative, negotiation, decision, discharge. So you have a variety of cases. I will resend the book, or the NHS also, as Dr. Salma said, you can read it carefully. I think end of life care can be given, Dr. Sarah, at home. Yes, I agree. Because end of life, so you just give him the time to die at home between the family members. So we should encourage discharge of the patient. Yes, exactly. Advanced care planning, is it same end of life care? Advanced care plan, yes.
Yeah, it is the
Yeah,
same.
almost, yes. Dr. Rashid, Dr. Hatem, anticipatory medication must be in home or can be given in hospital also. And the patient has the right to choice where to take it.
Yeah. According to the patient, if the patient he wished to die in the hospital, yeah, he can die in the hospital. They will put him inside room and die in the hospital.
Yeah,
And if he want to die at home, they will facilitate through
yeah.
the fast track discharge at home, even with oxygen and everything. Some people want to die in hospice. They send them to
Mhm.
hospice.
Yes.
They some need to in their care home, or even if they want to die in their like the country or village, they will send them to the village where they
Uh-huh.
live,
Yeah,
according where the patient
perfect.
he
Yeah,
want to die, his wishes.
yeah, perfect. Okay, Dr. Aisha, I think just deliver if deteriorated again, we will manage you by end of life plan. Okay, good point. Hospice care is the same as end of life care or something else? Yes, Dr. Muhammad. Already Dr. Maida answered this question. So it's area or center in which patient can go to this center as at the end of his life. So his condition would be terminal and he will die, or they are assigned to give care for the terminal cases. This is the hospice. But not every end of life care will go to the hospice. The one who decided or who want or wishes to go there. Because most of end of life care patient might die at hospital. Okay. Decision already made by him will ask about wishes. Why ask about wishes, Dr. Aisha? Yes, we have to ask because we are going to discharge him if he wish to die at home. Prolong his suffering, yes, Dr. Rashid. Advance directive and lasting power of attorney. Perfect. Good question and good point raised today. And both scenarios are perfect, really, and informative. And the way we discussed the comments. Any question before ending the session? Anyone has comment or sharing idea?
Thank you. Just regarding the alcohol,
Mm-hmm.
the cage, if you can repeat again.
Okay. C for cut down, the alcohol drink. The A for annoyed. Are you feeling annoyed by your drinking? The G for are you feeling guilty? The E, cage E, the last letter E for eye opening. Is it the first thing to do while waking up or eye opening your eyes in the early morning? Three of them positive or as yes, who would be alcoholic patient. And you have to refer this patient to the alcohol nurse or alcohol service to help him gradually stop or withdrawal of alcohol. If he suddenly stop the alcohol, he will have the withdrawal symptoms and you will be at risk to have or to the minus your marks if you didn't mention this. So please advise or refer such patient whenever the case is positive to the to alcohol services. Yes, Dr. Abdullah Hashim or Hisham, thank you. Nice session. Yes, thank you, everyone. Thank you, Dr. Ahmed and Dr. Mayada. Really good and perfect performance along with good scenario, informative scenarios.
Thank you very much.
Yeah, most welcome, Dr. Aisha. Dr. Ahmed. Thank you, everyone. We'll see you tomorrow, inshallah, with clinical day. Hopefully, it will make us either chest or cardiovascular, because we already did the neuro and the abdomen. Anyone has cases or want to practice with us tomorrow, chest or cardiovascular, it's our pleasure. I'm waiting. Just direct message me in the WhatsApp and I will arrange for that. Thank you, everyone. See you tomorrow, inshallah, with clinical day, short clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
وعليكم السلام ورحمة الله.